Good morning and good afternoon, everyone, and greetings from WHO Geneva. My name is Kerri Viney. I work in the People-Centred Services, Communities and Determinants Unit in the Global Program on Tuberculosis and Lung Health at WHO. Very pleased to be sending through this short pre-recorded message. And I just want to firstly thank the organisers of this third International Post-TB Symposium for the invitation to speak and participate in this policy and advocacy session, and also apologise for not being there in person. It's always much nicer, I think, to be there in person, but unfortunately, despite best efforts, we couldn't be there in person this time. So I'm going to give a very brief overview of what WHO is doing in terms of TB-associated disabilities and TB-associated lung disease. I'll go through some of these slides very quickly, but they'll be provided to you afterwards. So this just outlines some of the milestones in WHO's work on TB-associated disabilities. And of course, this includes the fact that integrated patient-centred TB care and prevention is a pillar of the WHO NTB strategy, and that includes reference to TB-associated disabilities and TB-associated lung disabilities. WHO published a framework for collaborative action on TB and comorbidities in 2022, and that's the document you can see at the top right of the screen in the teal colour. We commissioned a scoping review of literature on interventions to address TB-associated respiratory disability in 2023, which was published in 2024, and that's at the bottom right hand of the slide. And I think many people in that room were involved in this scoping review. We published a policy brief on TB-associated disability in 2023, which is the document you can see with the red panel on the right of the screen. Of course, there was the UN high-level meeting on the fight against TB and the resultant political declaration in 2023. And just this year, actually, we've published a policy brief on integrated approaches to TB and lung health, which is the document you can see in the dark blue colour on the right. And recently, I think many of you will be aware that the Global Tuberculosis Program has updated their name to the Global Program on Tuberculosis and Lung Health. So there'll be, of course, a firm focus still on tuberculosis, but recognising the broader lung health aspects as well. Now, I just mentioned the UN high-level meeting on the fight against TB held in New York in September 2023. I think you will all be aware that there was a political declaration arising from that high-level meeting, and this firmly recognises the fundamental importance of TB-associated disability. So you can see here on the screen, this is a direct quote from the political declaration, where member states have committed to strengthen comprehensive care for all people with TB using specific models of care, such as the ones in blue, which include rehabilitation and treatment of post-tuberculosis lung disease. And then this part of the declaration goes on to say that there should be particular attention paid to people in vulnerable situations or people who are vulnerable to TB. And this includes, again in blue, people with disabilities, including those with lifelong disabilities due to TB. So this is firmly reflected in the political declaration. Now, in terms of what WHO is doing right now at the moment, we are in the process of developing WHO guidance on the management of TB-associated lung diseases. I think some of you, or maybe many of you in the room, have been involved in the development of this guidance, so I'd just like to thank you for that. That work has been led by my colleague Ernesto Jaramillo, very capably supported by Delia Boccia. Now, the rationale for WHO guidance at this point in time, I think I probably don't need to tell this audience what the rationale is, but we do have some evidence and sufficient evidence on morbidity and mortality related to TB-associated lung diseases, both during and post-TB treatment. We have evidence on the added costs to the household associated with TB-associated lung diseases, again, both during and post-TB treatment, as well as the effects, the adverse effects on health-related quality of life. We know that there are poorer TB treatment outcomes among people affected with TB-associated lung diseases, and we have evidence of the global burden of TB-associated lung diseases, which is huge. However, despite the fact that we are aware of some interventions, of course, to prevent, manage, and address TB-associated lung diseases, there is less evidence on the feasibility and effectiveness of these interventions to manage TB-associated lung diseases, particularly under programmatic conditions. So the policy context really is that there is increasing interest and demand from academia, civil society, the medical sector, public health, and TB survivors for WHO to deliver advice and support on the management of TB-associated lung diseases. As I've just mentioned, there's increasing evidence of the burden and the consequences. There's a growing critical mass of global expertise in this field, and I think this is firmly reflected in your meeting where you're holding the 3rd International Post-TB Symposium with many experts in the field. There's increasing awareness and commitment to address this issue among key donors, and several countries are making inroads into the programmatic response to TB-associated lung diseases, including some of the countries who are listed here on the screen. So with all this in mind, WHO, as I mentioned, is in the process of developing guidance on the management of TB-associated lung diseases, and this will focus on some of the pulmonary conditions that are associated with impairment and disability during and post-TB disease. And what we'll be saying in this guidance is that this can be implemented under operational research conditions in view of the limited evidence on interventions to manage these conditions, particularly under programmatic conditions. And we hope that this will actually build the operational research evidence on the management of TB-associated lung diseases in the programmatic context. Now, this is quite a busy slide. I'm not going to go through it in detail, but this really represents schematically the scope of the WHO guidance on the management of TB-associated lung diseases. Represents the course of TB treatment before and after, and an outline of the interventions to prevent, screen, detect, and manage TB-associated lung diseases, including the timing of those interventions and measures to address the social determinants as well. So in terms of what the guidance will contain, this is just a very brief overview of the chapters of the guidance as well as the associated annexes. So you can see that there will be 4 main chapters in the guidance, an introduction that includes definitions, very important that we define what TB-associated lung diseases are, what is impairment, what is disability, etc. An overview of the epidemiology, including the burden and risk factors, the clinical presentation, and then a section on TB-associated lung diseases among children and adolescents. In Chapter 2, we'll focus on prevention of TB-associated lung diseases, and will include some aspects that are mentioned here in the box, such as vaccination, the management of air pollution, both indoor and outdoor, smoking and vaping cessation, and social protection. And my colleague Delia Boccia has provided a short pre-recorded message on social protection. Chapter 3 will refer to the clinical management of TB-associated lung diseases, including diagnostic assessment, treatment, and pulmonary rehabilitation. And then finally, in Chapter 4, we'll provide an outline of some of the interventions that can complement and enhance the clinical management of TB-associated lung diseases, including, of course, social protection, nutritional support, health education, and counselling and social support. Now, the guidance will contain a number of annexes, which are listed at the blue box in the bottom. So that will include elements of a generic operational research protocol, research priorities, some of the internationally recommended practices, an annex on spirometry, and some of the other medical treatment options. Some of this may change, of course, as we finalise the guidance, but this is a broad overview of the guidance. And finally, I will just conclude by acknowledging and thanking some colleagues. So I'd just like to thank you, the organisers and stakeholders of this third International Post-TB Symposium. Thank you for the invitation to speak and also for your interest in this topic. Thank you to my colleagues in the Global Program on Tuberculosis and Lung Health. Our director has a very keen interest in this, Dr. Teresa Kasayeva, and is steering this work. And I'd like to also say a special thanks to Ernesto and Delia, who have actually been leading the drafting of the guidance. And also thanks to our unit head, Farai, and Annabelle Badley, who's leading our work on TB and comorbidities. I'd also like to thank all of the experts who contributed to the development of the policy brief on TB-associated disability, and also the forthcoming guidance on the management of TB-associated lung diseases. And I think many of you will be in the room, so just like to thank you for that. My contact is here if you'd like to contact me about any aspect of the upcoming guidance or any aspect of this work. And I would just like to wish you a productive and engaging meeting. Again, I'm not sorry to not be there, And thank you for your attention, and thank you for your time and your attention on this important topic. Thank you very much.